I'm Jill Deneau. I'm a care coach here at Neura Health, and I meet with our patients and help support them with lifestyle change. I'm a functional medicine certified health coach, and what brought me to coaching actually was my own interest in learning about lifestyle modification for my own health purposes, and then decided that I wanted to help other people navigate those types of changes and help them stir up motivation within themselves. So that's kind of where it started as a personal journey and ended up as a journey that could help others. I was first most interested in and called to migraine specific conditions because I live with migraine myself. I thought that it was a field that is understudied, appreciated, right? And so that to me felt like, as a person who lives with migraine, I know how much it can be important to have someone alongside you that has empathy around those pieces of the journey. And so that's the special interest, I would say, in the field of neurology. But with growth with Neura, I've found an interest in epilepsy and post-concussion care and a handful of other things as well. They all require a little bit of empathy and care and just some special attention. So I'm interested in all of it now, but migraine was the first thing that pulled me there. Yeah, that's a great question. So I think when it comes to coaching patients, the main thing that I'm first concerned with is how do I, the official term is establish rapport, right? But I really want to just feel like I can get on the same level as these people I'm working with and just really understand and empathize with where they're at and get to know them as a person and who they are and what their interests are and what they want to get back to doing. And once I know some of those things, it can be helpful along the journey in terms of like their motivation and just kind of like gently nudging in areas that might help them open the door to change. And so I think for me, it's always empathy and kindness first and listening first. And then that leads me into your next question of, I think that is what patients need the most of, is they need to be seen and heard and validated, because especially with Neura Health, a lot of the patients come to us at the hardest parts in their journeys or kind of at the end of the line and they don't know where else to go. And so I just want to make sure that those people feel seen and validated and comfortable sharing what might be some of their most difficult times in their lives. And so I think that's the main thing, is just feeling like we can have a conversation and it can be honest and open and vulnerable and no judgment. Yeah, so I actually live with chronic migraine myself. I have migraine with aura and migraine without aura and ocular migraine. So it is something that I live with from day to day, and I'm navigating kind of right alongside our patients, which is an interesting path to take. Managing my migraine is a very well-rounded approach. I do have a neurologist and I have preventive medication and acute medications in my toolkit. And then I also really lean on what I know as a health coach, but just as a person with migraine, knowing what my contributing factors are. I think a lot of people call those things triggers, right? But I like to call them contributing factors because it's not always one-to-one. And so I do know that things like getting a good night's sleep, managing my stress, staying hydrated, removing, how do I say this? Stimuli that's too loud or too just gonna maybe throw me into a spiral, right? Those are some of the things that I'm just learning to navigate and manage throughout my day, and then knowing when I can lean on my medications or other tools like neuromodulation or essential oils or things like that throughout my day to just kind of take it day by day. When it comes to coaching, it's really meant to be as supportive and collaborative as possible. And so really anyone can be a good fit for coaching. It really just kind of comes down to, are you in a place where you have the bandwidth to work with someone on different lifestyle modification? When I say bandwidth, I mean anyone who's watching probably can relate to this, of like do you have the energy above and beyond where you're currently at to navigate lifestyle change? And sometimes it just takes a little bit of change to get a little bit more energy, and it's kind of that ball that collects, whatever the saying is, I don't know. But I do think that just about anyone is a fit for coaching, and our team is here to help you navigate those lifestyle changes one step at a time so that it's sustainable and not overwhelming. It's always from a place of no judgment. So if you're curious about it, let our team know.